Today I'm going to talk to you a little bit about speech delay versus autism. I'm talking to you about it because it's another question that comes up all of the time, and people ask this same question in many different ways. So I'm basically just narrowing it down to speech delay versus autism. A lot of parents out there are having a hard time, and because there's such a waiting list also to get your child evaluated, because you may have concerns with one or the other or both, because the waiting list is so long, I'm just trying here to give you a little bit of peace of mind. First, I want to say, first and foremost, if you're concerned about your child, schedule your child for a professional evaluation. And I stress professional because there are a lot of people who give their opinions out there who are well-meaning, but they don't have all the pieces. They don't know all of it. And not that everyone does, but I strongly advise you to get the opinion of a professional so that the professional can look at all of the pieces, ask all of the right questions. And if you're one of those people that have already gone ahead and scheduled your child, and you're just kind of like in the waiting game, I just want to stress to you right now that there are a lot of different things that you can look at. Sorry, I'm lowering my heat is blowing loudly. A lot of different components to language skills that can be delayed or on time, and still the child may or may not have autism. So there are a lot of speech delayed children who don't have autism. And there are also children with autism that do not necessarily have a speech delay. So at first I wanted to tell you that. But if you're reviewing the pre-language skills, and I will give you a link on whatever social media platform this ends up being on, I will make sure you have a link. It's a free download for all of the pre-language skills. It's important that you know what they are. But specifically, if a child is of age where you would expect that child to be able to be using language, expressive language skills, it's important to look at particular skills such as those pre-language skills like pointing, receptive language, eye contact, and joint attention. Not just attention in terms of how long they can attend, but joint attention. So eye contact is obvious. Maintaining, or joint attention is something like looking into seeing if your child is participating with you and looking for you to be joining them during a play activity. Children learn language best during playing. Remember that. So if you're playing and you're trying to bring out your child's language skills, look for that joint attention and look to see if they are including you, looking for you to turn take during an activity, laughing with you, looking at you, all that stuff. A lot of children with autism don't often have those skills. Those are particular skills that would be red flags. Also, receptive language I had mentioned. And what you're looking for with receptive language is how much do they understand? If you were to say, Michael, I want you to take this and throw this in the garbage, and he has no idea what you mean, and he's 2 or 3, and he doesn't know what it means to throw something away. Or if you ask him to, put something in the cabinet, or go throw your diaper away, or whatever it might be, you want to look to see if your child is actually following directions and if they're understanding the meaning of words. So that's also a pre-language skill, because we need to be able to have those skills in order to express ourselves. So if we're going to use a word, we need to know what the word means receptively in order to express it. So that's important. So those particular pre-language skills are things that you really want to look for. And if your child should be speaking and they just don't have those skills, I would say that's a red flag. Those are common characteristics that children with autism do have. Children who have an expressive speech and language delay, who are playing with you, have that joint attention, follow those directions, and are pointing when they need something. Those are all excellent skills to have in order to begin using language. And if your child has that and they're not yet using language, this isn't cut and dry, but I would say most likely they just have a speech and language delay. I had a couple notes here. Oh, one of the things I wanted to also have you think about is how do they communicate what they need and want? So a child with autism will often take the mother's hand or the dad's hand and pull them to what they want. They may not pull them and point to what they want, and they will not necessarily look at you and take you and bring you to what they want. Children who have autism will often take your hand and not make that eye contact and just bring you to what they want. That's a really important characteristic to think about. And as far as neurodivergent kids versus neurotypical kids with attention, children who are neurodivergent or children who may be on the spectrum don't focus, again, like I said, on getting your attention. So not just with grabbing you to bring you to something, but getting your attention in any communicative interaction or play activity, or if you're shopping in the store, they won't seek your attention. Children who are neurotypical will do something like that. So I hope this really helps. I'd like to go into a little bit more in another video to talk about the anxiety that comes along with socialization with children who are having expressive and receptive language delays versus children who are autistic. So I hope this was a little helpful for you, and please comment anywhere if you have more questions, and look for that free download in whatever platform you have here. If it's YouTube, I'm going to connect a link. If it's any other platform, I'll put the link in the comments. Have a great day.